teach you all about some hand expression and how to correctly set up a breast pump. The first thing is hand expression is really important for all of us. Where do you guys work at? What department?
ADE.
AD?
And the whole floor.
Whole floor. Okay, so we're going to teach you about where it's important on all floors. Hand expression. I'm going to hand you a sheet when you leave here. But the biggest thing with hand expression is we start in labor and delivery. If you have a NICU mom that we don't have a pump accessible right away, it's a good thing to distract mom to give her something to do when her baby's being whisked away to NICU. It works really well to get the milk started. If a baby is not there to do the work, hand expression works really well in place of that. It helps produce the hormones that gets the milk coming in. It also works really well if you have a baby that won't latch on, a baby with a slightly low blood sugar in labor and delivery, and you just need to get something into baby to boost that blood sugar. Sometimes it only takes a few drops of breast milk to kind of hike up that blood sugar number. It also is a beautiful thing to use in labor, delivery, and postpartum when a mom says she doesn't have any milk. Because we have I usually have an 80-90% success rate at getting at least a drop of milk to say, look, we have a drop for you. It also works really well when a baby's really fussy and not wanting to latch on to start to get the milk flowing. It gives the baby something to smell to get baby interested in latching on. That's why I find in postpartum we use it the most. The biggest
thing would be really good in labor and delivery and PACU if you can't, because it's so hard to find breast pumps sometimes.
Yep.
And you can't leave the patient by herself.
Exactly.
So hand express, it's right there. You can just do it without having to go search for a pump.
Exactly. And even if we don't get milk out, I always say to a mom, especially the NICU moms, that your preterms that you might not have much coming out right to start with, it is the best thing you could be doing for your body. You've delivered a baby, which helps signal to the hormones that it's time to produce milk, but even more important is the stimulation of baby or hand expression. So if we can do that in the first 1 or 2 hours of life, that really helps with the overall picture, the supply and demand of, I need milk, massage, your body gives you milk, okay? Another thing that's really important about is that you need to be doing it correctly. One, comfort for mom. If it hurts, they're not going to want to do it. And two, if you don't do it right, you don't get results. I tell moms the best thing to do first is to massage the tissue around like you're doing a self-breast exam. All that tissue needs all that milk, that loosens everything up, gets the milk kind of flowing. If you do that before you even try to get her hand in position to express milk, it's going to help make it a lot easier to get the milk out. The second most important thing is that you take her hand at the right place. I like to explain where a baby latches on. So where their lips hit is where we like to put our hands. So right where the areola meets the rest of the breast tissue behind. That spot's almost like a sweet spot. If we hit that spot, we get more milk out. A lot of women you've probably seen will try to just get it out the tip of her nipple. They'll be like, no milk, and there's milk, they're just pressing the wrong spot. And the way I explain to my patients is that it's like a tube of toothpaste. If you're squeezing the hard part at the top, where you screw on the lid, no milk comes out. But if your little 5-year-old takes a brand new tube of toothpaste and squeezes that real thick part of the toothpaste, it goes squirting all over your bathroom. That's where we want her hitting to get the right amount of milk, to get the milk to come out. Once she gets her hand in that position, or if you have a mom that's sick or not feeling well, where you get your hand, because it's important that we are comfortable with doing it for them as well, especially right after they deliver. We want to put our hand there, and then we want a deep tissue massage, I call it. And why I say that is a lot of times we'll try to do where we go back and forth on the skin. Well, if you've ever done that, like as a kid, the people do the little burns, it hurts, and you're not going to get any milk. We want to get down to that tissue. So I have them place their hand there, and then I explain it as a motion where you're almost moving your arm and your hand instead of your fingers. That kind of gets the right amount of milk and the correct milk. And most of the time, as soon as they see a little drop of milk, they're so happy that they've seen it. If they don't, remember, this is a long-term reason why we're doing all this. It's okay if they don't get a drop of milk to start with. That makes sense? Any questions about that? Okay. The other thing is this pump. Do you guys know how to hook one up?
No, can you please show me?
I will try my best. So, there are two things that I find. Well, one thing, or two of the most common problems why this thing doesn't work well are, one, what do you think is one of the reasons this doesn't turn on?
They're not plugged in.
It's not plugged in. So I first check to make sure it's plugged into the wall. What if it's still not working? I always turn it around, and this little sneaky little thing likes to come out. So I wiggle it back in there, okay? The other reason why I find it doesn't work are, before we start to hook this up, these little white things. You zoom? These little white things are called membranes, okay? And a lot of times they've either been misplaced, or sometimes they get stretched out, or they're just not on totally in place. I always check those, because even if they're brand new, sometimes they'll send us faulty ones. If for some reason they've been misplaced or they're not working, though sometimes you won't have any suction at all, okay? I just figured this out about a year ago after working here for 10, that the bag, your bag that everything comes in, has this little kit on the front, and it's just instructions that you've probably ignored a few times, but there are some secret membranes in there. As soon as I bring the bag in, I take these out and give these to Mom, because if she's taken I have her take everything home except for the pump. Make sure she doesn't take the pump, but everything else goes home, because everything will work on the Symphony, and also I think there's one other Medela pump it will work on, and regardless, from here out, like even these will work on quite a few different pumps. So that saves them a few dollars with replacement parts. Okay? So you turn your machine on. I usually have my mom sit up as much as she can. So if a C-section mom's at first, it's a little hard, but the more she can sit up, the easier it's going to be for her and you guys. We take these, we place them, wiggle them in, and you want to kind of make sure they're in there wet. Good, just clamp them down. This should shut easily. If this does not shut easily, it means that something's askew in there, okay? Everything from here all the way to here is a closed system. So when we go to clean everything, we don't worry about any of this stuff. We clean from here out when we go to clean it. Another trick is if you get some condensation in the line, which you might notice, there'll be some little foggy water drops. Turn the machine on, bump it up to as high as you can, and it gets all that condensation out. Okay? So, now we're at a place that we're going to hook her up. So, I've had women that say this hurts and they don't want to do it. This should not really hurt, okay? Babies usually hurt a mama more than the pump does. If it's hurting, we have a few things we can do to fix it. One is, when we first hook her up, we need to properly size her for the pump. You're going to have two in your kit. This one is the standard one that I usually put on first. This works for almost all our mamas. Some have, if they have a smaller nipple, not necessarily breast tissue size, but nipple size, that this one seems to work a little better for. If neither one of these are going to fit appropriately, you call your lactation consultant. They have bigger sizes as well. Okay? The way you tell if it's right is, I don't know if you can see this at all, but pretty much as it sucks the nipple in, you want to see just a little bit of space on each side. Okay? That's a perfect fit. If it's too small, it's going to rub the edges of her nipple on each side, and you might even hear a noise, like I hear almost like a popping noise as it's going in and out, and it's probably going to hurt. I mean, that would hurt, so she needs a bigger size. The other problem is when it's too big. It not only pulls the nipple in, but it'll pull the breast tissue in as well. This one is not caught as often, but this is a problem as well, because over time this can cause some pain. But also both of these are less effective at getting milk out than if she has a correct fit. So when we send her home, we want to make sure it's a correct fit. On top of that, I tell parents to take both of these. Don't toss the opposite one, because when you get home, either when your milk comes in or the opposite, when you had a fluid shift from MAG or whatever else, your nipple might be a different size and need a different size flange. Okay? So let's get back to setting it up. I get distracted easily. So when you get your kit, everything should be together, but I always teach a mom right away how to put this together in part, because it looks quite intimidating. I take the piece where the bottle goes on first. It only fits on one spot, okay? So I'll wiggle that in, and then I take the bottle and screw it on, okay? Then the flange only fits in one spot. And what's left is there's a little teeny little dot that only goes in one spot. Okay. They can do one on each side, or they can do both together. If there's someone, a support person in the room, and someone that can help them out, I just go ahead and do 2 at a time, just because if not, it's double the amount of time you have to use. You want to sit up. You want to put it at an angle so the milk goes into the cup and down. If you do it this way, especially when they only have a few drops at first, it's going to go everywhere instead of where it needs to go. When she's finished, you want her to scoop up and out, and that's going to catch any little drops that's left. Okay? When you go turn it on, you have her put them on, you turn it on, and you're going to see 3 little drops appear. Guys see that? I tell Mom, let me know when it hurts. And I start to bump it up. Start to bump it up, and then when she goes, ooh, that hurts, I turn it down 1 or 2 notches. What that's going to do is give her the most amount of sucking that she can tolerate. That might be 3 drops, that might be 10. All women have different sensitivities. I let her go 15 or 20 minutes, regardless if she's getting milk or not. If she is getting milk, I say go ahead and get what you can out, because every little drop counts. This is telling your body to produce more milk. Have her turn it off, and then when she's finished, we want her cleaning this every time. Milk can harbor some bacteria, so we have her take everything apart, including the little white membranes. Warm soapy water, we use palm olive here. I usually get a bucket out, warm soapy water, rinse everything out, put a towel down, a few towels, and let them air dry. A little olive oil, put it right here to reduce friction and also to help with the suction. You guys have questions?
How long should the mom use the pump for?
Like each time?
Yes.
I've been told 15-20 minutes total, just to kind of pretty much simulate what the baby would be doing. Any other questions?
If the mom is separated from the baby, say if the baby goes to NICU, when should she start to use this at minimal?
So, this needs to be initiated within the first 6 hours of
Okay.
life. Yep. So if we get our mom's manually expression in labor and delivery, and then by the time she gets to postpartum, she started this, we're on the right track to getting milk supply in.
If do all the rooms have the breast pumps in them?
I don't know. Over on an 8 tower, we have them in our clean supply room.
Okay.
Do you on 8D? Is that also the case?
Yeah, we try to keep them on our clean supply room, and if not, we can run down medical equipment and get them easily. So you always have your hands. So.
Yes, yeah, regardless, hand expression does work and count as long, not the most important, but second most important after making sure we do it is to make sure we chart it. So as far as our baby friendly and breast friendly stuff, we need to make sure we're documenting that we're helping these women get off on the right foot.
Do we have a way for them to collect anything that's coming out when they're hand expressing?
Yes, we do. So I do believe, does AD have some of the spoons as well, or do you have to get them from lactation?
Well, I've heard that lactation has special spoons, but you don't have to have a special spoon.
You don't have to
can just
have a
use a
special
plastic spoon. And I've also heard you can do it in like a bottle, or if you want to squeeze it into a bottle, a little spoon, a specimen cup, like anything that
Great.
sterols, whatever.
Also, in labor and delivery, you might only have a few drops. And any drop counts, especially for blood sugar and just giving the baby what they need. If baby's right there, the best thing to do is take that drop, scoop it up in your finger, and put it right on their little lips, or let them suck that off, because that is the ideal situation.
Thank you, Kara.
You're welcome.
Thank you.